I'm in the person of Earlyne, a third-year student of Asanta Western. And today I'm going to give you a short video about tinnitus and then how it occurs. When you say tinnitus, tinnitus is a condition characterized by hearing sounds in your ears. It either comes from within you. These sounds may be constant, it may range in volume and also in pitch. Tinnitus can be caused by a variety of factors such as infection, you being exposed to loudness, and then certain medications we use, and then head injuries. We are going to move on by talking about the clinical features, which are the signs and symptoms of tinnitus. When you talk about the signs and symptoms, we have perception of sound in one or both ears, and then we also have sounds can be ringing, buzzing, or continuous. That means these sounds can be consistent for a long period of time. We have diagnostic investigations for tinnitus. These diagnostic investigations include imaging studies, and then these imaging studies are magnetic resonance tests, which we say MRI, and then we have CT scan, which means computer tomography scan, and also we have physical examinations, and then the present signs and symptoms, which can give us more information about the patient's condition in order for we to be able to diagnose these issues. I will move on by talking about the medical treatment for tinnitus. In the medical treatment for tinnitus, we have certain conditions that can cause tinnitus. So therefore, we have to treat these underlying conditions. We have conditions like high blood pressure, infection, earwax build-up in the ears. We also can treat tinnitus through cognitive behavioral therapy, and then sound therapy may also help in treating tinnitus. I'll move on by talking about the medication such as antidepressants and then anti-anxiety drugs, which may be prescribed for a patient suffering from tinnitus. We have a specific nursing care for tinnitus, which may include encouraging patients to seek medical attention immediately they find out that they are having sounds or hearing sounds in their ears. Also monitor the medication usage. You have to monitor for the side effects of these drugs, and then you have to know and provide emotional support for your patients. Preventive measures for tinnitus may include earplugs such as concert and managing stress and anxiety. All this will help in treating tinnitus. Health education involves encouraging hearing use of exposure to. Health education involves encouraging the frequent check to identify any treatment for hearing loss, educating patients on the risks of exposure to loud noise and the importance of protecting their hearing, most especially using of earpiece by using a earpiece which has cords. In summary, tinnitus is believed to be as a result of changes in the auditory system, which talks about the ear, including damage to the hair cells in the inner ears, and then changes in neural activity and emotional and cognitive factors. Thank you.